The ability to maintain homeostasis is dependent on efficient respiration. Efficient breathing requires an intact, freely movable thoraco-abdominal cage. Let's look at the structures involved and where restrictions might interfere. There are 3 diaphragms that determine the relative pressures within the chambers of the thoraco-abdominal cylinder. The first is the thoraco-abdominal diaphragm, which divides the abdomen and the thorax and must be able to move superiorly and inferiorly. The next is the cervical fascia, which attaches to the first rib and forms a diaphragm at the top of the thoraco-abdominal cylinder. The pelvic diaphragm must work in unison and parallel to the thoracic diaphragm. For maximal efficiency, the ribs and the spine must also have maximal, unobstructed movement. The movement of the spine is influenced by the crest of the diaphragm, which attaches to the lumbar vertebral bodies. The alternating pressures of the thorax and abdominal cavity are the major pump of the lymphatic fluid and venous blood. Lymphatic flow increases circulating immune globulins and reabsorbs fluids, proteins, and cellular debris. The lungs are passive in normal inhalation and exhalation. The process is fully dependent on structural influences. Decreased movement of the thoraco-abdominal cylinder causes or worsens pneumonia. Dysfunction at the C3 through C5 area affects the phrenic nerve, which innervates the thoraco-abdominal diaphragm and affects its function. Notice the decreased motion of the diaphragm. All lymph from the lungs must drain through the thoracic inlet and empty into the venous system. Dysfunction of the thoracic inlet impedes the flow of lymph and blood. This interferes in the drainage of the pulmonary exudate. Notice the pneumonia worsening as lymphatic flow slows. Dysfunction of the thoracic or lumbar spine further decreases the ability to generate pressure differentials and worsens the effects of lymphatic stasis. The structural effects of rib dysfunction magnify the effects of the other thoracolumbar cylinder structural problems. Dysfunction in this area will alter the autonomic balance to the lungs. The sympathetic chain ganglia is just anterior to and affected by dysfunction of the costovertebral joint. The sympathetic supply to the lungs comes from T2 through T7, and the parasympathetics come from the upper cervical area. This same area controls arterial flow to the lungs, and so dysfunction decreases the delivery of nutrients, oxygen, immune globulins, as well as antibiotics, thus slowing healing. Parasympathetic predominance causes bronchial constriction and thinning mucus. Sympathetic predominance causes bronchodilation and thicker mucus. OMT is used to remove dysfunction and restore normal autonomic balance. We can use any OMT modality to treat dysfunctional areas of the body to restore motion and normal autonomic balance, as well as fluid flow.